Mental health is health, and everybody experiences something related to mental health. It's not whether it's there or not, it's to what degree. We are humans having human experiences, and our mental health is no different than our physical health. So for people who may think that mental health is a sign of weakness, everybody experiences mental health, but it is very different and unique to each individual as to how they're impacted. And we tend to bury things that we don't want to address. And those things show up in a lot of physical ailments or physical experiences in the body. Mental health is really everything to our overall well-being. When we are in a good place mentally and emotionally, we take care of ourselves and the things around us, the people around us, very differently. We are connected, we have purpose, we are engaging in meaningful activity. And those are all markers for longevity in life and also just like a life well lived. And so when people are maybe not engaging in the things that they really enjoy or with people that they really enjoy, that's usually an indication that something is going on mentally or emotionally. But there's kind of the saying that where the body goes, the brain will follow. And so if you can be active in a way that's supportive to you, doing things, whether that's in community and relationship or physically, that can improve the connectedness. Winter climate, such as ours, really kind of makes for kind of the perfect recipe of people isolating more. And when we're isolated and not in connection or purposeful activity, that really impacts how we are functioning and feel about ourselves. There is the concept of coping, which is helpful, which is really just like short-term skill-based things that can help somebody through a difficult time, like gentle movement. If people are feeling really intense emotions or thoughts, feelings, some really good distractions can help. And some of those things are splashing cold water on your face, doing short burst, intense physical exercise, if that's something that they can do. Things like journaling, expression and creativity. And I think we downplay the importance of play, just in general in our life, especially for adults, and even like our teens. Getting out and doing something playful can be really, really helpful to cope and bring us back into our body and back into the present moment. I would say by nature of the developmental stage of teens, what they're going through is transformative through major growth and challenging learning curves, a lot of social dynamics that can really ramp up anxiety as well. I would normalize it. We as humans pick up experiences as our life goes on, and some of those are really positive and healthy experiences that improve our well-being, and some of those are really difficult and tricky and that we're impacted by long after they happen. And when we collect those, it impacts our physical health just as much as our mental and emotional health. And when we have a collection of those kind of building up, we seek out unhealthy coping skills. Sometimes that's alcohol, substance use, but I can assure you nobody sits down and says, you know what would be really helpful to my life is a substance use issue. They're doing that because they're lacking connection and lacking other ways of coping because the things that they've tried haven't been effective. And substances can be very effective at reducing the pain that somebody's feeling. And so there also shouldn't be shame in that. If there's anything that people could take away, it's that there's a treatment for what people are feeling. There's a treatment for really challenging things that people are going through. Suicidal ideation, the desire to want to die, the desire to no longer be alive, there is treatment for that, and people do not need to suffer through that alone. For family members or loved ones who have somebody in their life who may be experiencing suicidality, prevention is a great mindset, but also you have to know about it to some degree as well. And that's why, yes, prevention is a great message that we've all been hearing about, but also there's treatment. And that does not get talked about enough, especially to people who do experience it. For people who are really needing help fast or needing to talk to somebody, there's a lot of resources like the 988 suicide hotline. That's one that people can call when they're experiencing a mental health crisis. Schools typically have some good resources or ways to connect students to helpers in the community. Even people like primary care physicians can be a helpful first step. Sanford Health has locations in Bemidji, Park Rapids, Walker, Cass Lake, Black Duck, Bagley. Our local crisis team is connected in the Lake of the Woods community. There's other great agencies as well in the areas, Stellar, North Holmes, Lake Country. And I think everybody could benefit from therapy at some point in their life. Through various phases of your life, it's really helpful and healthy to just go in, consider it like a normal checkup. There are ways you can heal from this and you can live like the bold, bright, colorful life that you've always wanted.